Good morning, everybody. Vince Burke here. As I promised, the second physical therapy session for the homecoming of the COVID patient. I know we're in trying times again, and now the COVID patients are home. They're a little bit more mobile, they're safer, they're out of the hospital, they're at that acute phase of healing. So I want to bring to you a little bit of more advanced exercises, this time standing up. You know, as a physical therapist, again, it's one of those things that I want to be reaching out for my role in radarship. I feel that it's my responsibility from a community standpoint of view. I want you to count on me, and I just want to be there for you. So this is what I like to do. So anyway, you did those chair exercises, which are vitally important. And again, what I want everybody to do is think to have a chair, okay? And the first thing you want to think about is you're standing up, you're breathing, okay? And you're going to do some heel raises, okay? Heel raises. You're going to come up on your toes, okay, just like this. Make sure you're breathing. When you exert yourself, you're breathing. Remember, the calf muscle here, I call it the external heart. That's important to work because we've been in a very dependent position, less circulation, blood flow, so we need to activate the calf muscle to get some facilitation of oxygen to your body and move it, all right? So again, heel raises, okay? Next thing we're gonna think about is the knee, okay? The knee. So just go ankle and knee. Okay, so you could bend your knee just like this. You may get a little stretch or pull here, that's fine. Do the other leg. Make sure you're holding on for safety, okay? Next thing is the hip, okay? We're gonna come out to the side, just like this. Make sure you're breathing. Whenever you do any type of movement, right, you want to exhale when you exert yourself. Whisper to yourself. 1, 2. Then you want to go back into extension on a 45-degree angle, okay? That's really important. You want to switch sides, of course, and switch sides. The big thing is that you want to pace yourself. Some may say how many reps. This is not a time to really determine how many reps, you know, max, rush through things. If you just do 3 to 5, great, sit down. That's why the chair is here, pace yourself. The next time do 7 and 10. The next time you could do it in the morning, in the afternoon. I mean, you can just keep on going with this, but you want to really make my quote stick. Stillness causes illness. And remember, this is a lung pathology disease. Even if you have COPD, even if you have other issues, you know, that you can't get to the doctor and you're prescribed to move, this is the way to go, okay? The other thing is that what I want you to do is when we're standing, turn your body this way, okay? Hold on here. Now, if you're unstable, okay, on one side, you could easily just go to the other side. However you feel comfortable, it doesn't really matter, okay? And do some marching in place, okay? Just marching. Just like this, and you can march. You can even come forward. Just kick your leg out. Again, you're standing, okay? Standing, okay? Standing. You could switch back and forth. March. If you don't feel comfortable to constantly do it, you know, to switch, because sometimes that can make you feel off balance, just do 3 at this side, right? And then you can go around to the other side, okay? And have 3. Now, if you don't feel that comfortable, okay, safety is important. The last thing you need to do is fall. So, like I said, remember last time 2 chairs? 2 chairs are great. You're here, okay? okay? And you need to take a break, you sit down and rest. Then you can do your heel raises, okay? You can do your kickouts, okay? If you can't do all of these, do some, okay? Remember we talked about this? We did the marching, okay? And you can stand up. Use this for assistance. If you have the walker, remember you don't pull on a walker. So having a chair here is good for safety, for sure, if you fall, okay? Even if you do happen to fall on the ground, okay? At least this could break up the fall, because who's coming to your house? That's important. So, you know, I need to go that next level for you is to prepare you to fall. And if you do fall, what happens? Well, you know, we don't like to think that way, but if you happen to be on the ground, and you know, you're on the ground and you have chairs here, at least you can kind of get here, you know, get up here, even with someone behind you, okay? And you can kind of pull yourself up and push yourself up, okay? And at least somebody is behind you to help you. You're not breathing on them, because it's important to think, go behind, don't pull on somebody. So that's important. So at least you have these chairs to help you climb up. That's key, all right? So even if you want to, if you have two chairs, okay? Now you could even have one behind you for sitting, but at least you're here, okay? And then you're more secure with it. Good posture, you're breathing, okay? Doing your leg extensions, your hip extensions. So there's other things that you could do, okay? So I want to go over a little bit of gait training. Remember the other day we talked about gait training using a cane, okay? But really it was for a walker, but now the same idea. You want the cane, okay, to be at the hip level, elbow bent like 20 degrees, okay? So when we're walking, okay, the cane is going to go on the opposite side of the weak side. So it's going to go like this, just like this, okay? It's opposite. So if my right leg, hip, knee is weaker on the right, then you put this in your left hand. So you want to make this tripod. It's a triangle. Now, we can go, for safety, we can go step 2. And if you're more advanced, you're going to step through. Big difference. So in the beginning, okay, you may want to just step 2. Nice and easy. Nice and easy, okay? So when we think about getting up from the chair, if I'm sitting all the way back here, it's very, very difficult to get up. So you want to sit and scoot at the edge, okay? You can have the cane here to help you a little bit. Place your hand here. You can rock, okay? And then you're going to stand up. That's important. Another activity is to practice that. You know, in life, the number one exercise that we all do is squat. And into the car, out of the car, in the chair, out of the chair, restaurants, whatever it is. We are always bending, stooping, squatting. We don't realize it, so get good at it. So you want to reach back and sit down. You're here. That in itself is an exercise. You want to go down slow and breathe and push up and down. So you can practice from getting up from a chair and down slow. Once you get up, we set up our walking area, okay? And just have a distance to another chair, okay? And you can sit. Okay, so you can make yourself a little bit of a circuit train. Wait here a little bit, okay? Then you can get up, okay? And you can walk over here, okay? Remember we said make sure that your knees are behind here, sitting down and squatting. Okay, so that's plenty of exercise that you could do for physical therapy, the first, second week, whatever it is, however you're feeling. Always check with your medical team, your providers, to see if you're a candidate for some of these exercises, that's important. This is not about no pain, no gain. It's about function. Stillness causes illness. Prevention of having a setback, heading back to the hospital, and getting this out of your lungs and being on the move. Till next time, Vince Burke, coming soon. Lesson 3, next week.